All right. What I'm going to be doing or demonstrating is a glenohumeral joint motion with mobilization with movement. And then it is belt assisted. And so the indications for this is that my patient has frozen shoulder or adhesive capsulitis, and she has loss of either active or passive range of motion. She may have pain, limited range, and then also weakness from disuse. So frozen shoulder actually creates this, well, it's the reason it's called frozen shoulders, because this adhesive capsulitis prevents this motion in flexion, extension, abduction, internal and external rotation. And so with those capsular adhesions or adherent axillary recess, the patient, what I want to do with the patient is to increase that extensibility of the capsule and stretch the soft tissue surrounding the capsule. So with the use of the belt, I can actually create an additional force to the glenohumeral joint at the proximal portion of the humerus. And so with the kinematics of the shoulder with flexion, go ahead, we're going to go do a flexion. So since it's a concave joint, it's going to roll anteriorly and glide posteriorly. And so with belt, I'm going to assist in that posterior glide. So as she is going anteriorly, it assists with that roll. And then we're going to do also an internal rotation, because if I did extension, I would have to be, I would go the opposite direction and provide an anterior glide. So because the glenohumeral joint rolls posteriorly. And then with internal and external rotation, it rolls posteriorly and glides anteriorly, and internal rotation is opposite, so it rolls anteriorly and glides posteriorly. So anyway, I'm just going to demonstrate two of them. The first one is actually for flexion. So I'm going to be behind my patient. She is seated at the edge of the table, and so to the front and to the corner. And I'm going to glide this to the proximal portion, right underneath her armpit, right at the glenohumeral, the point of the glenohumeral joint, right before it hits that AC joint. And I'm going to slide it back behind me and provide a glide posteriorly. So first I'm going to stabilize here at the scapula so she doesn't do too much of a upward rotation, so I'm stabilizing there. I'm going to draw back, and so I'm going to ask my patient to just go ahead and go into flexion. And as she does that, I'm going to provide a posterior glide to that. So in there I wasn't stabilizing. So we're going to go ahead and flex. Too much? All right. And as it does that, it's kind of like a little bit of a curve motion to assist with that. Do that one more time. So we'll do this about 3 sets of 10, giving a minute rest in between, and then doing this about 3 times a week. For 12 weeks, the study showed that the patients who did that frequency and intensity improved their mobility and functional ability. And so the theory behind it is intended to cause the repositioning of the bone. So we're actually going to do a same position, but I'm going to have her go into internal rotation. So I'm going to slide this around the waist this time. All right, so keeping your elbow at your side. It's because in internal rotation, it's the same motion. So go ahead and go from there, go to internal rotation. And bring it out. And as you go ahead, go in, you provide that posterior glide and then release as she returns to neutral. Go ahead, internal and release. So I'm stabilizing here at the scapula. So we could do that in any of the directions that's needed for to release those adhesions for frozen shoulder, for the adhesions for adhesive capsulitis of the glenohumeral joint.